Oh, good heavens. There we go. Sorry about that. All right. So again, we're going to be talking about adjustment disorders. Excuse me a second, just rearrange my screen just a little here. Okay. All right. So we thank you for joining us today for this webinar to talk about adjustment disorders and ways that we can support those folks in our lives that are diagnosed with an adjustment disorder. So our objectives today are to learn about what adjustment disorders are. We'll look at the DSM-5 criteria for an adjustment disorder diagnosis. We're going to learn about some of the common symptoms, and we'll talk about the different types of adjustment disorders. We'll also learn how adjustment disorders can affect those who live in long-term care. And we'll learn some supportive methods to help those experiencing adjustment disorder symptoms. All right, so what are adjustment disorders? Well, they're the result of a traumatic event or significant change in someone's life, which causes an excessive reaction. But it's more intense of a response than what would normally be experienced. So we all go through stressful situations and traumatic events at some point in our lives. It could be the death of somebody very close, a divorce, losing somebody's home or job, or moving into an assisted living facility or a nursing home. Any of those will be awful to go through, and it's to be expected to have a strong reaction to those kind of losses. But it can take some time to process big life changes, and that's perfectly normal for anybody. But it's when that reaction is disproportionate to the event and the psychological and physical symptoms continue causing disruption in our everyday lives that it may not be just ordinary depression or ordinary grief, but it's actually an adjustment disorder. So next, we're just going to watch a short informative video about adjustment disorders.
Adjustment disorders, what they are and how to fix them. Life in modern society can get pretty stressful and in some cases overwhelming. Certain events we live through are so huge that we don't feel the same after they're over. They keep affecting us like our minds just don't know how to cope with the severity of the changes. Sometimes that adjustment doesn't go smoothly, and this is when we get into adjustment disorders. The strangest thing here is, it doesn't necessarily matter if the life event was good or bad, nor does it matter if others were impacted or if it was only us. Whenever life throws a serious curveball at you, you have to make an adjustment to try and adapt. But there's no end to the unexpected symptoms we might go through when a big life event impacts us so hard it creates a disorder. Symptoms can range from crying to feeling agitated all the time, avoiding things you used to enjoy, acting out, getting depressed, overeating, substance abuse, you name it. Everyone experiences their own unique internal emotions and displays unique external behaviors when something major happens to them. But when symptoms get out of control or last for more than 3 months or so, that's when professional help is needed to screen for a true disorder. Broadly speaking, there are 2 categories that sufferers can fall into: acute and chronic. Someone suffering from acute adjustment disorder may have symptoms for 6 months or less, but those facing chronic challenges will feel discomfort even longer unless they seek help to address the problem. Falling under those 2 big categories, there are lots of subtypes of adjustment disorders. These all have annoying additive components like depressed mood, anxious mood, mixed anxiety and depressed mood, disturbance of conduction, in other words, behavior, disturbance of conduct and emotions, and unspecified. As you can see, there's no one-size-fits-all. Everyone is different, and every circumstance that leads to an adjustment problem is different too. One person might experience a disorder after moving to a new city and starting a new job. Someone else might suffer after retiring, or getting married, or having a baby, all events that are otherwise positive. Other situations, such as traumatic events like being a victim of a crime, being injured in a car accident, or the loss of a relative, can also contribute to adjustment disorders. Circumstances and symptoms may be all different, but there's one thing in common. When symptoms get bad enough or go on long enough, they'll turn your life into a real downer if they're not managed. Anyone of any age can experience an adjustment disorder, though it's more commonly associated with children and adolescents. Why? Because they have less practice in dealing with changes. They're not quite as resilient yet, so big changes are harder for them to cope with. The divorce of parents is a common cause of adjustment disorders for children. But that doesn't mean adults should ignore symptoms. Just the opposite. When an adult finds themselves in over their head, the best thing to do is to recognize their situation and get help. Adjustment disorders are often temporary, but can become chronic problems or lead to other mental wellness challenges if left untreated. There's no reason to let a short-term problem grow into a long-term one when professional help can quickly offer effective solutions to get back on track and start enjoying life. Now that you know more about adjustment disorders, take comfort in knowing that Imperium is
All right. So when we think about stress, I feel like most of us automatically assume that it's something negative or bad that's happened that's caused it. But stress isn't always bad or detrimental. So think about what good or positive stress may be. Getting a new job, starting a new career, having a baby or planning a wedding. And if anyone has ever seen or been a bridezilla, you know that's the case. And while those are all wonderful and exciting experiences and a natural part of our life, they are also very stressful times for us. Starting a new job or changing careers is very stressful. You're the new kid. You're starting from scratch. You want to do well. You're learning how things are done, company policies and protocols. You're meeting your coworkers and hoping they like you, and vice versa. Getting married and starting a family, those are monumental life changes. And there are so many decisions to be made. Just planning the wedding, pick a date, who's invited, where are we going to have it at, the florist, the caterers, and working to pull all those moving parts together, all those minute little details. And anyone who's ever planned a big wedding will tell you that the biggest stressor wasn't the wedding itself, it was planning it. Starting a family, having that first child can be such a wonderful experience for anybody. Preparing the nursery, having a baby shower, buying a whole new world of supplies like diapers, powders, clothes, creams, bottles. And then suddenly they're here. So, oh my goodness, now what? Who decided letting me take this kid home from the hospital was a good idea? What do I do when they start to cry? What if I don't have the car seat in right? How do I know how to take care of them? How do I know how to comfort them? I mean, the list can go on and on. Planning a vacation, working out logistics, getting dates off work, what to pack, who will take care of things at home while you're gone? Or what about the holidays? Shopping and parties, decorating and baking, gift exchanges and family gatherings of every kind for the next few months. Or you get to retire. Now what? What am I going to do with myself every day? What if I don't save enough money to last me forever? What if I get bored? Or what if I just hate being retired? Said no one in the history of the world ever, I'm sure. But all of that is stressful, some more than others, but it's stressful nonetheless. But if we move forward in each instance and look at what happens after a little bit, a passage of time, that stress passes, right? You've simply adjusted to your new normal. You've gotten used to the routine at work, at your new job. You've made some friends and you're learning the ropes. You're comfortable. The wedding turned out beautifully, went off without a hitch. And it's like the new baby's been there forever. You can't imagine what it was like before they came. The family vacation went great. Uncle Bob almost missed the flight, but he made it. And we survived the holidays with new memories and no major family disasters or drama. Or after retiring, you found plenty enough to occupy your time with those newly freed up days, and you're so much more happier for it. So stress isn't always going to be a bad thing. It just takes some time to adjust to our new normal, right? Does anybody have any other examples of what that might be? Good stress? Any thoughts? Is there anything in the chat, Kim? Okay. All right. So wherever you may be providing care for somebody, whether it's in a long-term care facility, assisted living, group homes, or private settings, that place should be and feel like a safe space for clients. So there's no place for any type of judgment. It's not up to us to determine what is stressful or upsetting to another person. They are the ones who get to determine that. Now, just because something doesn't appear to be bad, a bad situation to you, doesn't mean that it's not a bad situation for that person. For example, let's take the college experience. There are many, many people who went on to college and had the best experience of their life. They had supportive families backing them up. They had a great roommate. They made friends. They adjusted well to all of the new and exciting changes. They formed lifetime relationships with all kinds of new people. Maybe they joined a sorority or a fraternity. They got involved with campus life, possibly. They thrived during their college years. They went on to live successful lives, and that's great for those people. Because then there are those who went on to college and it was the exact opposite. They didn't have that initial support. Maybe they had a roommate they couldn't get along with. They had mean professors. They weren't making friends, isolating themselves to avoid the groups of friends who were everywhere, or their advisor was always too busy or just didn't seem to get it for them. Nothing went well, and it was a traumatic, and their mental health may have suffered because of it. So, what may help a person adjust to college could be different for each person. If someone has additional support from an RA, a professor, and or their advisor, that person's transition is likely to be smoother, right? Our role is to withhold any sort of judgment and to hear that person out. Use active listening to fully comprehend what it is that they're dealing with. Show some empathy for what they're going through and offer the support that they need from you. So we have acute versus chronic. Now, one could be diagnosed as either having acute or chronic adjustment disorder. One diagnosed with an acute adjustment disorder means that those symptoms have lasted less than 6 months, and either they have adjusted to the change or event in their life, or maybe they sought treatment. Now, chronic adjustment disorders are when symptoms have been disruptive to one's life for 6 months or longer. If the stressful occurrence continues, or if one goes without treatment for their adjustment disorder. The DSM-5 is the Diagnostic and Statistical Manual of Mental Disorders, and that's the handbook used to diagnose mental disorders. When one meets certain criteria listed in the DSM-5, they may be diagnosed with a specific type of adjustment disorder. So what is an adjustment disorder? Again, an adjustment disorder temporarily changes the way one feels and or thinks about the world around them. But it's being completely different than just being stressed out. It's more than that. It's not those feelings of, feelings, those ordinary everyday stressors that we all experience at one point or another. The emotional or behavioral symptoms develop within 3 months from the start of the stressful event in life, and they're clinically significant. This means that your stress must exceed what would normally be expected, and or the stress is causing significant problems in your work, home, and social life. So there are major issues present in one's personal and professional life, and that could be getting divorced, the loss of a loved one, or losing their job unexpectedly, facing retirement, having to sell their home and belongings and move to a long-term care facility. One experiences symptoms that are not related to any other physical or mental illness, meaning that there haven't been any other mental health or physical diagnosis that might be responsible for the symptoms that they're having. We all experience grief at some point in our lives. However, adjustment disorder symptoms are not part of the normal grieving process. Now, it's human nature to grieve when we lose someone or something that's very important to us, and it's natural. We all go through that. It's when that grief begins affecting how one lives their life that it's time to seek help or treatment. Just for example, maybe grandma has agreed to move to a long-term care facility due to her failing health, the fact that she lives alone and making it a safety risk for her because she lives in a multi-story house. It's hard for her to navigate at home now by herself. She went through all of her belongings, selling things, giving things away, including her family home. So grandma understandably is grieving that loss and struggling with that transition. So after a few months, her family may begin to note that she doesn't really seem to be recovering. Grandma's been isolating herself in her room. She doesn't socialize with the other residents. She's lost weight because she's refusing to eat. So now she's beginning to show symptoms of an adjustment disorder. So those common symptoms can occur within 3 months of the traumatic event or activating event. They can include things like feeling depressed, which are like having feelings of hopelessness, being sad, not feeling happy or experiencing joy when somebody normally would. Maybe they're crying frequently. Exhibiting impulsive or reckless behavior, that can be having no regard for one's own safety, taking more risks than normally. Maybe they're driving way too fast, drinking heavily, or using illicit drugs. Someone may be becoming easily agitated. It may be a sense of restlessness or feeling cranky or uneasy. They could be quick tempered or easily angered, just being short with and snapping at everybody around them. They could be experiencing body aches or soreness, physical symptoms such as dull pain that affects multiple joints, body parts, or even one's entire body, like having stiff, sore muscles with aching, or having difficulty concentrating, being unable to focus on a task for a prolonged period of time. And it can look like the person's just daydreaming or being unable to sit still, or maybe they're just easily distracted. They could be feeling anxious. So a person could feel uneasy or worried, not about anything specific, just in general. Maybe they fear the worst and they're just unable to relax. They're tired, but they can't sleep. A person may find themselves not sleeping well or not sleeping at all sometimes. Their mind races constantly and they're unable to relax to be able to drift off to sleep. Or having an irregular heartbeat. So, anxiety sets off the body's fight or flight response. When one feels uneasy about a situation, their heart rate can increase. Such, excuse me, someone may say their heart feels like it's fluttering or there's pounding in their chest, or maybe it can feel like their heart skipped a beat or an irregular heartbeat. There are 6 types of adjustment disorders, and each one will have its own symptoms. There is adjustment disorder with depressed mood, adjustment disorder with anxiety, adjustment disorder with mixed anxiety and depression, adjustment disorder, with disturbance of conduct, and adjustment disorder with mixed disturbance of conduct or emotions and mixed, sorry, I got tongue tied a little bit, an adjustment disorder unspecified. So now let's talk about each type and we'll look at some of the examples of what those types might look like. All right, so adjustment mood with depressed mood. I'm having a heck of a time. Adjustment disorder with depressed mood. There we go. Symptoms include experiencing feelings of sadness or hopelessness, crying all the time, not experiencing feelings of joy when you would usually be happy. Next, we're going to show you a brief video of an adjustment disorder with depressed mood. Now, this particular client is concerned about housing for him and his mother and the stress of carrying the weight of that concern for his family.
You know, we have a nurse that comes to the house once a week for a couple hours to help out, but it's just us.
So is that your mother's house you're living in?
Yeah, it is. But I don't know how long we're gonna be there. We're like 3 or 4 months behind on the mortgage, and the bank keeps calling every once in a while to threaten to kick us out if we don't pay our bills, I guess. And it's tough, you know. It makes me think about what it would be like if we did get kicked out, and you know, I was homeless with my mom. What do I do with her?
Next, we have adjustment disorder with anxiety. Symptoms for this type include feelings of nervousness, being worried or anxious, or just feeling overwhelmed. One may have trouble concentrating, their heart may be racing, or they could be real jittery. So, the next video example, this client is experiencing anxiety as a result of relocating from the East Coast to the West Coast.
It's this barrier, and I have no social life except for Margaret, my neighbor, who is also an East Coast transplant. It's just I just don't like the people, and I just go and I sit at home each night and basically watch television.
Join.
Next is adjustment disorder with anxiety and depression. All right, so one here is experiencing both anxiety and depressive symptoms. So that would be having all of those feelings that come with feeling depressed, sadness, frequent crying, or feeling hopelessness. And while they're going through that, they're also going through the anxiety symptoms. They're feeling worried, they're nervous, they're unable to concentrate. So in the next video, this client is an Iraqi war veteran who has adjustment disorder with anxiety and depression. And it's impacting how he perceives himself.
No, not. I haven't really talked to anybody since I got back from Iraq. I didn't really call them. Just didn't really feel the need. I didn't honestly. I don't want them to see me like I am right now.
What do you mean, like you are now?
You know, the war in Iraq was tough. You know, nerves were shattered pretty bad. You know, I just didn't really feel like talking to anybody. Didn't really want to go anywhere. Didn't really want to do anything. You know, I just didn't feel good.
Now we have adjustment disorder with disturbance of conduct. This is an adjustment disorder that is characterized by a change in behavior that violates the social norms and the rights of others. Those symptoms may look like acting rebellious, maybe by not taking their meds or refusing to turn out the bedside light because they're upset with their roommate. Destruction of property, like punching walls, slamming doors when that person is frustrated, angry, or upset. They're driving recklessly, going much too far over the speed limit, swerving through traffic, or drinking and driving. Or active impulsively, like making bad decisions without considering what the consequences might be from those. Your client actually bought everything in their Amazon cart without thinking that they don't have any money now until they get paid again at the beginning of next month. Alcohol and/or substance abuse is another way that someone may act out. A person tells themselves they feel better after a few drinks, or they're attempting to self-medicate. Adjustment disorder with mixed disturbance of emotions and conduct. This is a condition that involves a combination of emotional and behavioral symptoms in response to a stressful event. Emotional disturbance symptoms may include having feelings of depression and/or anxiety, having those feelings of hopelessness, but at the same time, feelings of nervousness. Your client can appear sad, withdrawn, staying in their room and keeping to themselves, but at the same time, they have that nervous energy about them. Pacing, wringing their hands together. Their foot is constantly tapping against the chair leg. And along with emotional disturbance is the disturbance of conduct symptoms one may also experience, violating the rights of others by being aggressive, fighting, or being, physically aggressive toward another person. Engaging in physical altercations like fighting or hitting. Destruction of property, like pulling their TV off the stand, punching holes in the walls, breaking windows, or physically acting out in a destructive manner. Adjustment disorder unspecified is used when one has a severe reaction to a stressor, but it doesn't really fit into any of the other adjustment disorder subtypes, and it doesn't present with significant depression or anxious mood. A person may become withdrawn from work, social, and academic activities. They stop attending family gatherings, going to events. They may avoid friends and social situations that they normally would seek out and enjoy going to. Maybe they're missing class, calling off work, or they're being tardy, missing deadlines, not getting assignments completed, or finishing their work on time. One may be more irritable than they normally would, snapping at people, frowning, just generally being unpleasant. Or they could have anxiety. They appear nervous, fidgety. They could exhibit impulsive behaviors, like make a major life decision without discussing with one's family or loved ones, or quitting their job without a new one or a backup plan. One may present with physical symptoms like complaining of headaches and body aches. They may complain of heart palpitations, that feeling we get when our heart is fluttering or pounding in our chest. And they could have some insomnia, not getting enough of that good restful sleep that we all need. They may experience some changes in appetite, and that can go one way or the other. Either they're eating way more than normal or they're not hardly eating at all. So, adjustment disorders within long-term care. Now, as we get older, we all face a mountain of medical, emotional, physical, and mental health challenges and changes. Our health, minds, and bodies deteriorate as a natural part of the aging process, and it's different for everybody. Whether it's one of the many age-related illnesses or the fact that we can't quite remember things as clearly as what we used to, noticing that we're becoming less physically active as we get older, worrying about our ability to care for ourselves, how to pay for it, who will help us when we need it. The list can go on and on of things, but it's a lot. So transitioning into long-term care is a major life decision and a major life event. It can be one of the biggest adjustments to be made by a person. It's also a very traumatic event. There are those who suffer a serious medical condition, which leaves them with long-term care suddenly and unexpectedly. And then there are those individuals who are able and are included in the decision-making process for them to move into an LTC. Adjusting to that move can be understandably difficult and stressful. Regardless of the circumstances that made it necessary for the person to move, it's a huge impact on their life. Once the decision is made, then comes what can be the daunting task of finding a facility to move to, a place that will meet the needs of the person being served, and then come even more stressful decisions. How do we pay for it? What does insurance cover? Can I keep my doctors and possible attorneys if there are power of attorney issues involved? The entire process can be incredibly overwhelming. And all of that is just the beginning. Now comes the really hard part. Now they have to give up their home and all of their belongings. Imagine having to move from a home full of beloved items and memories and then being forced to downsize it all to what fits into a room, and in many cases, a half a room because they have a roommate. That in itself is a significant loss for anybody. So now they've lost their along with that, they've lost their independence, the ability to come and go as they please. Friends and family don't always visit as often as what they did when they had relationships with their neighbors and in the community. They're no longer in control of their own finances. Everything they have or will have will go toward their care now. They no longer have control over very much of their lives anymore. Now, if I'm someone who likes to go for a walk when I feel angry or I'm upset, maybe I can't do that anymore. That's no longer an option. They've had to either sell, give away, or throw away everything they've spent their life building. And that would be incredibly challenging, even under the best of circumstances. So it's easy to see how a move or living in a long-term care facility can negatively impact someone's mental health. So why does any of this matter to us? Well, because as caregivers, you have the ability to support those that may suffer from an adjustment disorder, either because of the move or they've already had the diagnosis. All right, so how can staff help? So how can you help your client who might be experiencing symptoms because of an adjustment disorder? So being aware of someone's diagnosis is very important for many reasons. But for the purpose of today's training, why is that important? Why does that matter? Knowing the diagnosis allows you to determine what kind of support they're going to need. Working together, you and your client will find those coping skills that are effective and that work best for them. Not every skill or exercise is right for everybody, and it is necessary to learn from those skills that they are comfortable practicing. Otherwise, they may be very less likely to utilize them. We encourage them to engage fully in their treatment. Let them know that you're there to support them throughout the whole process. Modeling optimism in the treatment process, as well as those behaviors and actions that we want to see in our clients, you need their buy-in, right? You need for them to believe that treatment will help. They will feel better at the end of it. So if you believe it, then they're more likely to believe it as well. Our body language and our facial expressions speak volumes. So be sure that they are reflective of what it is you're trying to communicate to your client. Be mindful that when interacting with clients, they pick up on the same things that we do, right? They pick up on physical cues. So it's important to be sincere and be honest. And you should also be modeling a positive, encouraging outlook. If they see and believe that you're optimistic and excited, then they are very much more likely to show that same response. Anybody have any other thoughts on things that staff can do to support somebody? Is there anything in the chat? Okay. All right. So some supportive steps that we can offer. Now we're going to talk about some supportive methods that you can utilize with your clients. Healthy coping skills. Those are behaviors that can help make sense of difficult or stressful situations in a productive and a positive way. They can aid the people you support into managing their emotions in a way of giving people options for effective coping mechanisms for stress and emotion control. Educate, practice, and encourage clients to try different coping skills to help them find what's beneficial for them. Exercises that they are actually willing to try and that they will actually use when they're feeling stressed out. Activities like deep breathing, journaling, exercising, mindfulness, or relaxation exercises, just to name a few. One example of a coping skill is journaling. Journaling is an effective coping tool for someone when they're experiencing symptoms related to adjustment disorder diagnosis. Now, there are options for how one elects to journal. Do they want to write it out by hand, in which case, just ensure that they have the supplies they need: tablets, paper, pens, pencils. Are they somebody who's more comfortable using technology? Hey, that's great too. There are many journaling apps available, some for free, others are free, but you have to pay the premium in order to get the full use. A perfect free option is actually the note feature on a cell phone or by using a Word document on a tablet or a laptop. Free, simple and free. So if your client's okay with that, there you go. Encourage them to be creative in their journaling. Use it as a means of self-expression. There are no rules for what journaling should look like. It can be a list, a poem, just letting their thoughts flow freely, drawing, tracing, any method that lets one express what they need to is perfect. There's a freedom to journaling, a sense of expression that's unique to the person writing. Clients can express themselves freely, they can get their feelings out, and it can help produce ideas like brainstorming. Journaling can also be a way for somebody to track their mental health symptoms, documenting when they're feeling down, sad, happy. When they have a good day, a bad day, they can document what made it a good day or what made it a bad day. There's no right or wrong way to journal, but it can be helpful to put some thought into it. Things like, what do they hope to accomplish from it? What is their goal for keeping a journal? Is it just a way to release feelings or emotions? Maybe it will help to manage their emotions. Journaling can absolutely serve multiple purposes for them. So encourage your client to determine a time and a place and commit to keeping a journal. Make an appointment with themselves. Maybe they have a comfy place in their room or a quiet place somewhere in the facility that they can find comfortable to sit and write. Make it part of the routine, daily, weekly, bi-weekly, whenever they feel like it would be most helpful to them. Open communication. We want to encourage that with our patients and clients so they openly express their feelings and worries at any time. When someone is new to an LTC, they're probably so overwhelmed with so many big changes. Create a welcoming atmosphere for them so they feel secure enough to be able to express their wants and needs to you. If a client has been living in an LTC for a while, still encourage that communication with you. Excuse me. Facility staff, nurses, and administrators, whomever it may be. For someone who may be more hesitant to speak up for themselves, practice with them. Do some role playing with them. Help them have the confidence to speak up for themselves or to have a conversation with somebody. Role playing is an awesome tool. So we can be proactive. So instead of focusing on the problems about what is going wrong, we can try to encourage our clients or our residents to take a proactive approach towards their mental health, educating them about making healthy lifestyle choices. Some examples of what that may look like: making and maintaining a personal connection. Making and maintaining personal connections, like building relationships with facility staff and peers. That's a true support system that they'll utilize every single day. They need that. We want them to make and have friends with other residents and to have a good relationship with the staff so that they feel comfortable when they do need to ask for help. Staying physically active can help relieve stress and it can help them sleep better. Now, that can be as simple as walking a few laps around the halls of the facility or going to the local YMCA for a class or a swim. There are plenty of simple exercise programs available for those with limited mobility as well. So you can assist your client in helping them find the perfect physical activity that they might enjoy and that will benefit them. Having regular checkups for mental and physical health is important. Keeping those medical appointments or therapies and continuing to follow up on those when they need to. Now, if your client is someone with frequent medical appointments or they just have a little trouble remembering all of them, help them create a calendar where they can track appointments and important events. It can be helpful for someone to have a visual reminder sometimes. Maybe your client is one who could benefit from practicing mindfulness techniques. It could be 2 to 3 minutes. It could be 15 to 20 minutes or anywhere in between. How does your client feel about that? What are they comfortable with doing? And give them the tools and teach them how to effectively use those tools. You can print out and show them various online mindfulness exercises and let them decide for themselves. So grandma and mom were actually right. Eating a healthy, balanced diet is a vital part of taking care of ourselves. So educating our client about the benefits associated with healthy eating can be encouraging for them. Look at different recipes or options that are available at certain facilities. Getting a good night's sleep allows someone to be alert and aware by allowing the body and the mind to rest and recharge. So just if I could get a couple, what happens when somebody moves into an LTC? Like, is there anything that anybody does special to welcome anybody? Anybody? No? Okay.
If you'd like to use the chat, go ahead and we'll give
Yeah,
people
absolutely. Please
give
do.
people a minute maybe to type if they're going to use
Yeah.
the chat.
Want you guys to be
It's just
interactive.
interesting to compare and contrast
Yeah.
different facilities approaches to welcoming, or if there's a process of
Mhm.
intake, I guess, if welcoming is part of intake. It's always interesting to hear that. Oh, okay. So Jennifer
Awesome.
says welcome baskets.
I love that.
Okay.
That sounds so nice. That sounds like so Betty White, doesn't it?
Yeah. So Jennifer, would you mind telling us what's maybe in the welcome baskets, or maybe purpose, or how that goes? Is there a
Yes,
process for
usually
that?
several of the facilities that I go to have welcome baskets that have it's the bedpan, it's the the soaps, all the stuff that they would need, like the soap, shampoo, conditioner, fingernail clippers, hairbrush, deodorant, stuff like that. And then in some baskets I've seen a little blanket or socks, the little
Yeah.
socks.
I love
So
socks. That's great. Thank you. I love
Mhm.
that.
That's great. Thank you
Thanks
for
for sharing
sharing.
that. All
We
right.
have another comment.
Awesome.
Giovanni, Giannini. Maybe I'm sorry if I'm saying that incorrectly. Do welcome bags that has a facility, looks like a facility branded tumbler, pad of paper, and pen, and information about the facility. Okay.
Love
So
that.
yeah, kind of same question. How does that go? Is there an explanation maybe of information about the facility? Is there a process for welcoming? How does that go? If you can unmute and share, or if you want to put it in the chat, that's fine too.
Mhm.
We'll give them a second.
It's okay.
Sometimes,
Yeah.
sometimes it takes
But
a
I
minute
do like that.
to type all that out.
Yeah. But I do. That's a nice idea, though.
That's
You know what I
awesome.
mean? It's like, you're welcome. Help them find a seat in the dining room. I like that. Oh, that's great.
Okay. So we got a follow up on the welcome bags,
Mhm.
brochures on therapy department and programs in the facility. Okay. Very good. Helping. So it sounds like Amanda, you're kind of describing, kind of helping people make connections, or
Yeah.
sort of starting the ball rolling with relationships. That's great. So to
That
me,
is.
that says you kind of have to know your people a little bit. The people who are
Yeah.
there, you have to have a relationship with them to know who to link them with, or know who to introduce them to. So that's great. You're starting relationships or starting introductions right off the bat.
That's awesome. Thank you all so much for sharing.
You may have like a welcoming committee. It's an unofficial welcoming committee.
Yeah. That's
There.
never
That's
going to be a
awesome.
bad thing.
That's great. Thank you, Amanda.
Thank you, guys. All right.
Thank you so much for sharing. Appreciate that. So sounds like there's an official welcome and then maybe an unofficial
Yeah,
welcome that's happening as
it
well.
does. I love that. All right. So something else we can do is encourage self-care. Just kind of like the welcome basket described, with the soaps, the deodorants, things like that. So encouraging those we support to prioritize, their self-care practices. By practicing self-care, someone could improve their resilience, their general overall well-being. Share the benefits of self-care with your clients and residents. Self-care can be many things. So knowing the wants and needs of those that you actually support, that's really going to help you to help them in creating their own routine to make it part of their schedule. And that could be like just taking a step back from the situation or the person and spending some time at home or spending some time alone. Putting yourself first can be perceived as selfish, but it's not. Like, it's never selfish, because again, we got to take care of ourselves. We're just as deserving as time and care as those we spend our time taking care of. Forgiving yourself can be a difficult step for some, but it's an important step. Setting boundaries and or saying no is absolutely self-care. It's advocating for oneself. So encourage your clients to ask for help or anything that they may need. There are times they may not want to hit that call button because they don't want to bother, or they think the staff is too busy. They just don't want to bug anybody. So ensure that they know that their needs are just as important as everything else. And we want them to feel comfortable and confident in being able to ask for help and not feel like a burden. Creating a routine or a daily schedule. So think about how you feel when you know what's coming for the day ahead, right? We get up in the morning, we get ready for the day, shower, get dressed, you have coffee, maybe some breakfast. I mean, it varies for everybody. For me personally, I stop at the same convenience store every single morning. I've been stopping there for years. Now, there have been a couple of times that I was either running late and no time to stop, or they were closed for whatever reason, whatever the case may be. And honestly, my whole day was thrown off from that point on. My routine was entirely disrupted. So it's reassuring for anybody to have that routine, to have that schedule. It's just nice to have the structure. So not having it can create anxiety for anybody. So for a person dealing with adjustment disorders or any other mental health diagnosis, it would be very easy to just stay in the room, avoid socializing any more than is absolutely necessary, and just let the time pass them by. So we can think of a daily schedule too as little daily goals being met. It's beneficial for mental health symptoms, and it's good to frame it in a positive light. Having a regular daily routine or schedule gives structure to the day, and it's a great way to practice self-care as well. Having a predictable routine can provide a sense of control and normalcy. Encourage your client to establish regular times, like for eating, for sleeping, relaxing, going to events. For those living in long-term care, encourage them to make a date with their friends within the facility. For example, every Wednesday morning, Mary has a standing date with her friends in the facility to meet in the dining room for breakfast or coffee. Afterwards, Mary likes to go tidy her room up before lunch. So each day after lunch, Mary then joins a small group of residents for an afternoon walk. Mary has a routine. It may be more structured and encompass each day. Maybe having a schedule for each day would benefit somebody with adjustment disorder because it does offer stability and sameness. And then there are the physical benefits of having a schedule or routine. Encouraging somebody to get up and move. So as much as they can, that's just another added benefit. So what about your particular facilities? And just kind of think about that. What does a day in the life look like there? Helping clients know what the daily schedule can look like, them learning a schedule and beginning to fit in. You can talk to them about the routine of the facility. What's the daily routine? Tell them the daily routine there and see how their routine may fit in with it for somebody new. But what can happen if we don't stick to a schedule? Anybody? See the chat. It can become upsetting. It can be disorientation. Yes, absolutely. It can be confusing. Showing patience and understanding to your clients. Always remember that every person's journey is different. And adjustment takes time for everybody. Allowing your residents and clients to express their emotions and then providing them with the support throughout that process requires empathy and patience and a lot of understanding on your part. Having patience and being understanding of the mental health needs of your clients allows you to effectively support them. So next, we're going to watch another short video, and this one's about empathy. Oops. Sorry. Yeah, there we go.
My name is Mike Campsey. I am an interventional cardiologist and the chief of cardiology at Wheeling Hospital.
So what is empathy, and why is it very different than sympathy? Empathy fuels connection. Sympathy drives disconnection. Empathy, it's very interesting. Teresa Wiseman is a nursing scholar who studied professions, very diverse professions where empathy is relevant, and came up with 4 qualities of empathy. Perspective taking, the ability to take the perspective of another person or recognize their perspective as their truth. Staying out of judgment, not easy when you enjoy it as much as most of us do. Recognizing emotion in other people and then communicating that. Empathy is feeling with people. And to me, I always think of empathy as this kind of sacred space when someone's kind of in a deep hole and they shout out from the bottom and they say, I'm stuck, it's dark, I'm overwhelmed. And then we look and we say, hey, climb down. I know what it's like down here, and you're not alone. Sympathy is, ooh, it's bad, no. You want a sandwich? Empathy is a choice, and it's a vulnerable choice, because in order to connect with you, I have to connect with something in myself that knows that feeling. Rarely, if ever, does an empathic response begin with at least. Yeah. And we do it all the time, because you know what? Someone just shared something with us that's incredibly painful, and we're trying to silver lining it. I don't think that's a verb, but I'm using it as one. We're trying to put the silver lining around it. So I had a miscarriage. Oh, at least you know you can get pregnant. I think my marriage is falling apart. At least you have a marriage. John's getting kicked out of school. At least Sarah is an A student. But one of the things we do sometimes in the face of very difficult conversations is we try to make things better. If I share something with you that's very difficult, I'd rather you say, I don't even know what to say right now. I'm just so glad you told me. Because the truth is, rarely can a response make something better. What makes something better is connection.
All right. So being empathetic, see the world. And what we mean by that is try to see the world through your residents' eyes. Try to see things from their point of view, from their perspective. Appreciating them as human beings. Be non-judgmental. See that other person as their own human being who is valuable in their own right. Understand feelings. Understand how someone else is feelings and communicating that understanding to them. And communicating understanding is just letting someone know that you hear what they're saying, that they are understood, that they are seen, that they're heard. So think about it this way. What if you spent the weekend at a friend's house? You're in their space, you're functioning on their schedule, eating whatever it is they decide to cook, sleeping in a strange bed. It smells a little weird. Maybe they could live in a remote location in the middle of absolutely nowhere. No easy access to anything. But at the end of the weekend, you get to go home, right? You get to go back to your safe space, to your own house, to your own belongings. So someone in an LTC, they don't get to go home at the end of the weekend, sadly. They have to adjust. So there really isn't another option for them. And that may give us just a small example of the stress that one may feel when they've had to move into long-term care. So it's important to recognize the significance that relationships can play in a person's life, their mental health struggles, and their treatments and outcomes. Depending on the relationship, it can either have a positive or a negative impact on someone. If a person is struggling after moving to college, what may help one person adjust to college life, as we said before, could be completely different for someone else. If one student has that additional support from their residential advisor, their professors, or their academic advisor, then that person's transition is easier, smoother. Then there's that student who lacked that additional support. Their transition is not that smooth. So it's those supportive, positive relationships that make a person feel that they're not alone in a situation, right? That somebody does have their back. Your presence as a helping professional can assist in the person's adjustment. Do they have a close family relationships with a spouse or a partner, children, grandchildren, siblings, parents? What about those other relationships that we all have with our closest friends, our neighbors, church friends, or community groups? That person may have been part of those kind of things at one time. So having healthy, supportive relationships, that can help your client who's experiencing adjustment disorder symptoms. Consistency of knowing that they have somebody in their corner. That can boost their confidence and their ability to navigate their mental health diagnosis for successful treatment. But on the flip side, there are also relationships that can make symptoms worsen. If there's an unhealthy relationship with an ex or a relative, there's nothing beneficial for the resident's mental health in that particular relationship. So what does all this mean? Understanding what adjustment disorders and types are and what symptoms can look like lets you be better able to support your clients and residents who may be diagnosed with an adjustment disorder. Offering effective support when they're experiencing symptoms by encouraging open communication between you and your resident. Communication between, you will be better able to assist them and be educated about their diagnosis and symptoms to help them learn and practice healthy coping skills. Now we are helping clients to learn and experience the benefits of self-care and benefits and different methods that one can practice. So remembering the importance of our actions or reactions to how a client may respond to treatment. Be aware that our role is not to judge, but to support and to encourage. We can give our clients a safe space to say or feel whatever they need to manage those symptoms they're having. Recognizing that there is also positive stress that will impact us, but it's still stress. We should be assuring clients that we are a safe place for them and that they are supported and that we hear them and that we see them. And that. So thank you all for joining us today to learn more about adjustment disorders and the ways that you can support somebody with a diagnosis. We still have like 5 minutes. If anybody had any examples, do you have any residents, or any thoughts? Yeah.
Okay.
All right.
Yeah, we do have a few minutes left, so Stacy and I can hang around for a couple more minutes if there's any questions or comments. If you wouldn't mind filling out a quick survey, let us know how we did. Also on the survey are some questions. If there's topics that you would like to hear more about, we are definitely open to feedback to provide trainings that are relevant to the people that you support, or if there's topics that you would like to learn more about, we can try to meet those needs. Also, join us next month. We always have these, I believe, on the third Wednesday of every month. Next month's topic will be from an outside provider on Huntington's disease. So look forward to seeing you next month. And thank you for joining us.
Thanks, everybody. Have a great week.
I'll stop.